Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. For this video, I want to talk about walking on a treadmill after knee replacement surgery. What are some of the pros and cons, and what are my recommendations when I work with clients when it comes to walking and using a treadmill for exercise? So, there are definitely some positive aspects of walking on a treadmill. So, some of the traditional thought was that walking on a treadmill is a little bit of a high impact and can put some stress through your joints and through your knee. But really, when you compare it to just your normal daily activities and daily lifestyle, the amount of impact through your knees when walking on a treadmill is relatively low. It's not too significant. Now, there are other exercises that you can do that are going to put even less impact and less stress through your knees. Things like using an elliptical machine, cycling, or using a recumbent bike or a stationary bike, or also doing aquatic exercise or pool exercises are going to put even less stress on the knees. But comparatively speaking, using a treadmill is going to be relatively low stress on your knee joints. Some other benefits of using a treadmill are that you have a very controlled environment. So you have a nice flat surface and even surface at all the times. You can keep it nice and level, or you can put a little bit of an incline. That's your choice or the therapist's choice. You also have some handrails or grab bars that you can hold onto while you're using the treadmill. So for example, if you're someone who is trying to work on improving something with your walking, maybe you're walking with a limp or for a little bit, or you're trying to take nice big steps, you can kind of slow the speed down and you can hold on with your arms until you feel more comfortable taking those nice good steps without holding on. So that's a good benefit as well. And just the ability to really kind of play around with the different parameters while you're using the treadmill to achieve whatever goal you're trying to achieve, that's definitely a really good benefit. So some of the cons, some of the negatives that you could potentially say for using a treadmill are, one, it can be a little makes somebody anxious or a little bit fearful if you're someone who doesn't have experience using a treadmill prior to your knee replacement, or you just have never used a treadmill before or haven't used it too much or don't trust yourself on there. It can lead to a little bit of anxiety, a little bit of fear. And typically, I'm not going to put someone who has that doesn't have that much experience with a treadmill or feels a little bit uncomfortable. I typically won't use the treadmill for exercise. I might use some other means, either just walking on level surfaces or using the elliptical machine or using a recumbent bike. There's plenty of different options out there. And the other thing to think about with a treadmill is it isn't exactly like walking on level ground. Yes, it's very similar and you can definitely get a lot of the same benefits, but it is a little different, of course, when you're propelling your body yourself through your muscles when you're on level ground compared to the surface is moving underneath you when you're on a treadmill. So just a couple of things to keep in mind. So when it comes to using a treadmill after knee replacement surgery, typically what I'll do is it depends on the individual. If you're someone who has used a treadmill prior to surgery, you're comfortable using a treadmill, you'd like to continue being able to use the treadmill for your exercise and physical activity, then that's something I'll definitely incorporate into my rehab, is getting back on that treadmill, getting comfortable using it, and possibly also using it to help correct something with your walking if you're working on trying to take bigger steps or working on your gait speed, whatever it may be. If you're someone who, I've never used a treadmill before, I don't really have that as a goal to get back to using a treadmill since I never did use one, and I don't want to, then typically I won't use the treadmill with that person. I'll find other ways of exercising and staying active, if that's an elliptical machine, if that's doing aquatic exercise or pool exercises, or using a recumbent bike, whatever that may be. So those are my thoughts on use of a treadmill after knee replacement surgery. I think it has a lot of benefits and can be used effectively in certain circumstances, but not necessarily for everyone, and that's okay. So thank you very much for watching, and take care, everyone.